Hello everyone, welcome to Talking Health with DrLaz, your favorite health program on television. Happy New Year to you, wherever you're watching us from, Nigeria, West Africa, anywhere in the world. We're very excited to be with you this year, 2023. Thank God for life, for those who are able to make it, and may God bless the souls of those that passed on in the previous year. On this program, we keep talking health because without health, we have nothing. And we are very much pleased with the feedback we've been getting from you through our various social media channels and those that we also come in contact with. That's what has been keeping us going this far. And we thank the entire production team in Talk Health Nigeria, Dark Communications PLC, particularly AIT. So many persons behind this show. You see me and my guest, but you have more than 7 persons behind the scene that make sure that, every week you get to watch this. We can't thank them enough. So this 2023 is an election year, of course, in February, on 25th February, the Presidential and National Assembly elections will take place. And on 11th March, the governorship elections will also take place. Please, as you elect candidates of your choice, please elect those that will help to make our hospitals work. Vote for those that will help to strengthen our health sector. Vote for those that will help to ensure that the health workers we train in Nigeria, that majority of them stay, work here happily, and make sure that we save lives. Vote for those that will help to expand health insurance coverage so that people will be able to afford quality health care without financial difficulties. Vote for governors who will help to make our primary health care work. Vote for governors who will help to ensure that private health facilities are performing optimally, providing adequate supervision. Vote for legislators who will provide adequate oversight, excellent oversight on the executive to make sure that everybody is held accountable. Vote for those who will appoint competent hands that have the wherewithal, to make sure that our primary healthcare facilities are general hospitals or district or cottage hospitals, or tertiary hospitals, federal medical centers, teaching hospitals that they are performing optimally. And very importantly, vote for those that will make sure that the social determinants for health, quality education, making sure that women go to school, making sure that we have adequate nutrition, making sure that we have security, making sure that our roads are good enough, and also making sure that people drive safely and also observe, go for regular medical checkup to ensure that they have the best possible quality of life. Health is everything. One way or the other, if you have a job and you have money, you'll be healthier than someone that wakes up and not sure of what to eat. So put all these into consideration because all of us, want the best health, and prevention is better. So the better the quality of life in Nigeria, the healthier we are all going to be 2023 and beyond. So on the show today, we're just going to take you back to 2022, highlights of a number of programs we had. We had more than 40 episodes. Earlier in 2022, there was the Nations Cup. So in many weeks, this station was showing live matches, So that's why we didn't have for a number of weeks. But at least we had more than 40 episodes. There was much more diversity. Overall, we've done more than 100 episodes. I think this should be about 170 episodes. Thereabouts, and we're very happy how far we've gone. We are going to, in the next few weeks, the Health Agenda 2023, we are going to bring in as many candidates as possible in different political parties to discuss their health agenda for Nigerians. We're also going to bring political analysts or spokespersons to help to throw more light on the health agenda, whether it's for governorship or even the presidential candidates. So keep on with this show, and we can't wait to improve on our quality and keep giving you the best information you could get. So, highlights of our show in 2022. Please stay with us. We'll be right back.
Kidney failure, generally, you have people with so many things that lead to kidney failure. Some it's hypertension, the others are high blood pressures, diabetics. Others are even infections.
Drugs.
I have people with nephrotic syndrome, you know. So all these are things that accumulate that we don't know. And, you know, because of the health indices and health status of Nigerians, we're not careful of what we do. People don't do checkups. So you don't know until it has gotten to the tip, the total end, that you can't even have anything to do about it again.
Stages.
Okay, this normal flaccid penis without erection.
Okay, flaccid is the one that is at rest.
No, normal pressure, normal is not erect. So it's sexual stimulation that stimulates the process of erection. Okay. So when there's a sexual stimulation, what happens is that there are neurotransmitters that will be released from the cavernosa nerves, the nerve that supply that supply the penis. So this neurotransmitter is mainly nitric oxide. When it's released, it leads to production of what we call cyclic GMP, cyclic guanidine monophosphate, which now is the main agent that causes relaxation of the blood supply to the penis. That relaxation causes increased blood flow to the penis.
Okay, through the arteries.
Through the arteries, yes. Through the arteries into the cavernosa spaces.
Okay.
So that increased blood flow now starts the whole process. This is initiation. Then as the blood flow increases here, you can see as it increases and it flows in, the cavernosa spaces dilates. Yes, you can see expanding. So as it expands, it constricts the vein. This is the venous. As it enters and dilates the spaces, the venous outflow of the blood gets constricted,
okay,
preventing blood outflow from the penis.
Mental health is just as important, or not, even if not more important than physical health, because you can see someone who is physically incapacitated, they still work, they go out. But oftentimes when someone is mentally ill, they're not able, like the whole system is dysregulated and they can't function much.
Exactly.
Attached to anything that has to do with mental well-being. And I hope people realize that, like you said, it's just like physical well-being. And that sometimes things are not the way they're supposed to be, and there's no shame in asking for help. And I think it's very important for us all to stop shaming the process. When you see someone seeking for help, it's normal, it's okay, and it's okay. Sometimes things are just off. For example, about 23 years ago, when I had my first child, I had postpartum depression, but I didn't know that was what I was going through. Things were just off. People kept saying, oh, you should be happy, you've just had a baby. I wasn't happy. I was going through so much. It took years later before I realized.
One, at the state level, is for the state to allocate more resources to health and to get those resources released and utilized appropriately. Just like we said, Basic Healthcare Provision Fund, just like UBEC Fund also, when this federal release their money, there's a need, there's always a requirement for a counterpart from the state. This counterpart is not released. That's why you don't get the service done.
So the breaks in the DNA of the tumor, when by normal radiation, may be single-strand breaks or double-strand breaks. Single-strand breaks can be repaired easily. Double-strand breaks are a little more difficult to repair. While proton therapy, because the energy deposition is very intense, it is mainly in the form of double-strand breaks, which means many radio-resistant tumors, for example, chordomas. Chordomas are tumors, are basically lesions that occur in midline sites in the body, in the skull base or in the spine or in the sacrum. Now, traditionally, they are considered radio-resistant tumors. However, with proton therapy, the response is very good.
Nigeria has shown that except you build the systems, you just be oscillating. You just jump up today and come down tomorrow.
Zigzag direction.
So the focus on systems is good. I would support it, 100%. And the indicators actually have spoken a bit to some of the policy issues and things, starting the implementation of something like the Basic Healthcare Provision Fund is speaking about both political will issues, but also financing issues. Because before you start, you should be willing as a state to start, contributing to that bucket. And then what are states doing in terms of their own budgetary commitments as well, which is critical. And even beyond financing things, the human resources for health is actually, there are some basic things, whether you have the availability of some of those
and by human resources for you are talking about staff.
Yes.
Waste properly. So you have a way of putting all the waste inside one dustbin, and then when the popular Babambola, that the scavengers come, they have to now open the waste and start looking out for things. So the right thing is supposed to be to segregate the waste at source. So from your house or from your office or from the hospital, wherever you're operating from, to have different types of containers for different types of waste. So you have your one container for your plastics, nylon, plastic, water bottle, anything plastic will be in one. Then another one will be maybe for your kitchen waste, food, anything like that can decompose into one. And I have one maybe like for paper, plastics and all that. So you can have as much as 3, 4, 5, but normally you advise like at least for a start like 3.
The nervous system is that part of the body that actually controls everything. The brain is the master organ of the body, controls everything. It generates electricity, and that electricity, for that electricity to flow to the rest of the body, like you rightly said, it has to pass through a big cable of wire called the spinal cord. Ladies and gentlemen at home, if you remember, anybody who eats fish, who eats fish, that bone in the center of the fish is actually the spine. So the spine is actually a bone, That soft thing that you actually remove from the center of the fish is actually the spinal cord. So sometimes people confuse spine and spinal cord. So spine is a bone, and spinal cord is actually that soft tissue that goes in. And the spinal cord, like I said, is the cable of wire taking electricity from the brain to the rest of the body.
I was having my bath and I felt a lump on my breast. And I was like, what was this? Okay, actually it started in 2009. But December, and I went to hospital for that, and I did biopsy. And they took it for a test, and they discovered it was benign, that it wasn't cancerous, and I was happy. But 6 months later, I felt another lump at the same place, even though I didn't know it was a lump, because I kept on believing that it may be the scar from the former surgery I did at that particular place. So that when I felt it wasn't really getting smaller as it ought to be, I had to call the doctor, and the doctor asked me to come to the hospital, which I did. Another surgery was done, and then when the result came out, it was cancerous.
So you had...
First of all, the rights can be within the context of social, it can be cultural, it can be ethical, it can be professional. But the first thing we look at when we talk about patients' rights, when you look at the bill, the first thing that comes is the right to access to information.
Access to
information, very key. Every aspect of treatment of a patient, the patient is entitled to information on it. The diagnosis, including even the prognosis.
It's only today that I went to the program like this, like mental. I didn't hear anything about it before. It's only today. But when I came here, I'm very, very happy because I see many things here. People don't see here. When we like person we living with disability, if you are in our very house, we used to think many things. We think as if we are nothing in the world. But the way we come to the program today, the way I attend this program, the way I attend this program today, I feel it. I'm very, very happy today. In fact, I saw people here dancing. When they are singing, I even join them at times. If I notice, I'm happy. In fact, I'm very happy. Please, this program is good. Please, they should continue this. And if they want to do their program, they should couldn't lose people living with disability. Because the way we sit at home, we just feel as this, they didn't care with us. They didn't even bother to worry about us, our health. What is bothering us, nobody cares to us of us. Please, if something is going on like this, they should include us.
The National Mental Health Bill is something that we need to pass. It's currently with the National Assembly, and a petition over 1,000 individuals have signed asking for them to send it to the president and the president to sign it. And it has a couple of components that are key. You mentioned the Lunacy Act from 1958. If you actually look back, the regulatory framework for mental health in Nigeria actually dates back to 1916. It was actually codified as a law in 1958, but it has British colonial roots, which means that we need to, and yet UK has adopted new mental health legislation. We need to do the same here in Nigeria. Some of the components of the mental health bill have to do with one, human rights framework. So it prevents discrimination from employment, from housing and things like that, which is really key. As you know, there's supposed to be a percentage of funds that go to health, right? And some of those provisions of health and primary health care, some of those provisions, for instance, could go to mental health, not just general health in general. So there are aspects of current health financing that could be augmented to help supplement for this. But I think that the important thing is not necessarily where the funds come from, but what the funds are for. I got calls today for individuals asking where they could get pro bono mental health services, because seeing a psychiatrist in the country is difficult. Some people range it from 10,000 to 40,000. I know some people who pay hundreds of dollars to get mental health services here. So we need people to provide that kind of therapy. Drugs, for instance, is very key for individuals. Rehabilitation centers. Right now, the country only has 8 neuropsychiatric centers, hospitals.
Glaucoma is a silent thief of sight, such that glaucoma causes painless, irreversible loss of vision. So
painless, irreversible
loss of vision.
So the person will not feel anything.
Most of the time, you won't feel anything, particularly with the open angle type of glaucoma.
Okay.
It just creeps up on one gradually, and then they just feel they got suddenly blind. But that didn't happen suddenly. It had been in the eye all along, but because they never got to check with the ophthalmologist, they didn't have an idea that it existed there.
With Nigeria's very poor health indicators, that the government should have prioritized health care. I mean, we are discussing the Abuja declaration of 15%. Now, 1/3 of that is about 5%, which is what the government had done. That's not a pass mark. I had expected that as a minimum that the government should have come up with at least 50% of that benchmark, which is like 7.5% of the budget, the expenditure, being dedicated to the health sector. If you start with 7.5% and you are pleading, oh, we don't have resources, we have other things to do, it becomes more commonsensical. But to pledge 15 and to deliver 5 is not the way forward. It's not the way to go.
Every treatment has a duration. So even amongst the drug, you have different duration depending on what infection is being treated. So the best thing is to work with your doctor, work with your pharmacist to get the guidance of what the information is, what they want you to do in terms of how to use it. So people that stop before, this contributes to resistance, because once you stop, the bacteria become resistant. And it's very important to know that it's the bacteria that becomes resistant, not the human being. So we really need to be very careful, because what we do impacts other people and has impact on the ability for other people to use the drugs when they need it. Abuse is abnormal use. So anything that is abused, there's a use for it. When it's used abnormally, when it's used outside the recommended use, it becomes abuse. So even if an antibiotic is used for, it's being used for a specific infection, but then next time you think you have the same infection, or you think someone you know has the same infection, and you use it for that, what you presume it is using it abnormally. If you use it for what indication is not meant for, that's abnormal use.
Okay,
so that's abuse.
In that case, if someone has pneumonia and is prescribed a particular antibiotics, and someone else gets to use that antibiotics for urinary tract infection, which it might not be effective against, is an abuse.
Yes, so you're using it outside the normal use.
Yes.
Yes.
And also, if someone is supposed to use it for 5 days or 1 week, and the person uses it for 3 days, it's an abuse.
Exactly.
Or the person is supposed to...
Treatment options for uterine fibroid actually depends on the presentation. We have talked about the modes of presentation. Those ones that are incidental findings, like a woman that that has been sent for ultrasound for other purposes that is just discovered and incidentally actually needs no treatment. She can be followed up with a serial ultrasound scan 6 monthly or 3 monthly to know whether it's growing or not growing. For those that have symptoms, also the ones that are detected just incidentally that are intraoperative findings may not necessarily need treatment because the purpose for the surgery might not have been due to the fibroid, except there are some that are blocking the operation site.
I have a little issue on close to my eyes here. I just noticed it. I have to run down to National Hospital to go and check. I was even scared then. I was thinking it was skin cancer, but when I got to the hospital, the doctor now told me that it's not skin cancer, that it's just a minor skin infection. So mine was taken care of earlier, very early at the early stage. Although it was not a skin cancer, but it's because I was informed. That was why I went to the hospital. Some people will not be informed like that and they will stay. It will get to another level and become something serious.
What needs to be done to make our primary health centers work is a partnership. We've demonstrated this at the Garki example. There's primary, secondary there. Honestly, there is nowhere on earth that government alone does anything health. Health belongs to the Almighty God, not to government and not to private. Any mixture that makes our people healthier and live longer must be tolerated. That's the point. We cannot say, oh, government didn't do, government did. No. Pull all resources together. And we must be able to have excellent primary health care centers near where we live. The advantage will be that people don't have to have money to access those primary health care centers. They can go on any kind of low health insurance. Now that we have National Health Insurance Authority, every average citizen must be able to go to a primary health care center without saying, do I have money?
So many a time, what is happening in our civilization today is that we are eating a lot of carbs. Okay. We're eating more carbohydrates than we actually need to eat. And as such, you have people with excessive amounts because those carbohydrates, the body doesn't know any other thing to do with them than convert them to fat
and store in the body.
So it keeps building over time. People should understand that tobacco is simply a business. There's absolutely no benefit. It is a poison that has killed millions throughout history. And these facts are very clear.
Well, some will say they'll be smoking for 30 years and nothing has happened to them.
So the person who has been smoking for 30 years, do you want to see a picture of your lungs? It's not about saying nothing has happened to you. You know, we should look at you, we should take you and run the necessary, and you will see that even your vital capacity has reduced.
What's vital capacity?
So, sorry, when we say vital capacity, your breathing, expands, the breathing capacity of the individual, is on the decline.
In the FCT, this Wasa is a the most enlarged IDP so far in FCT. And then the number of population are about 5,718 people living in this IDP. And then the challenge that I'll be having for concerning this health post is that this place is open place. And then there's not enough room where now there's no labor room, and then secondly there's no equipment for taking the delivery.
What is Staphylococcus?
So Staphylococcus is a genus of bacteria, and under that genus you have so many species. Just like if you have monkeys, there are different types of monkeys. You have baboon, you have gorilla, you have chimpanzees, you have all kinds of monkeys. So also under Staphylococcus, when you just say Staphylococcus, you have different types of Staphylococcus. So we have Staphylococcus aureus, which is the one that a lot of people.
So we say Staphylococcus aureus.
Yes. You know, when you go to the bus stop and somebody puts a live microphone there, and then he says, "Loud Staphylococcus aureus." If you don't treat it, in fact, I've heard somebody say that if you don't treat it on time, it will turn to HIV. And,
very misleading information.
Very misleading information, and a lot of people with fear approach them, and then they are swindled of their hard-earned money. The important thing to know is that Staphylococcus lives, different types of them. Is it epididymis? Is it saprophyticus? They live on the body, and they are actually protective. They could be protective.
Like the one on our skin.
On our skin.
It's protective.
It can be protective of if you wash it away. You know, somebody says you want to use, I keep telling people that the best soap to use is to use your normal toilet soap.
Exactly.
By the time you are starting to use medicated soap and you are killing 99.999% of germs from your skin vulnerable to things that are not there. So Staphylococcus is a bacteria that is there. But however, when we have a skin break and then it enters your body, it can now cause problems. Yeah, it can now lead to, if it goes to where it's not meant to be, it enters your lungs. It can give you pneumonia. It enters your spine. It can give you, it can give you all kinds of meningitis.
So I hope you enjoyed watching those highlights. We can't wait to have you same station, same time next week. My name is Dr. Laz Eze. Once again, Happy New Year.